Bryan Johnson, Community Relations Manager for Modern, and I'm here with Melissa Selby. She's the Executive Director of the Community Care Clinic here in Boone. And tell us, Melissa, how long the clinic has been here and what is it that you do?
Well, the Community Care Clinic celebrated 10 years last year, so that was a pretty monumental event. We started out on Wednesday evenings for 3 hours a week, completely volunteer run, and now we're here over 40 hours a week, and we're providing care for health care for people that don't have health care insurance. In Watauga County primarily, but also in the surrounding counties as well.
And how do people find out about you? Like if I'm a person that needs some health care and I can't afford to go to the emergency room or the hospital, how does that happen?
You know, we have little surveys that we do and information that we collect from our patients, and one of the things that we find is really it's word of mouth that is getting the word out to most people that come to see us here. Obviously the hospital is a wonderful resource and referral for us, but word of mouth is really what seems to do the trick, and it's you know, it's such a wonderful thing to have a primary care home for people that don't have health insurance. Otherwise, they're ending up in the emergency room, sometimes for true emergencies because it's been so long since they've had care, sometimes for non-emergent visits because they can't go to a private doctor's office. And so when they come here, they're in just like any other medical facility. They have a primary care home and a provider who knows what's going on with their health care and can help get them to a point where those health outcomes can be improved.
Right. And you said earlier that these are people that kind of fall through the cracks.
Yes.
Right? For as far as medical care is concerned.
Right. Yeah, it's been termed the coverage gap. And so what happened when the Affordable Care Act was first put into place was Medicaid was supposed to be expanded, the eligibility requirements for Medicaid. Each state was supposed to expand those. And the Supreme Court ruled that they could not force states to expand Medicaid. So some did, some didn't. North Carolina did not. So what happened is we have low-income adults who don't fall into other categories that make them eligible for Medicaid, and they're in that coverage gap. And those are the people that we see. So those are adults that are under 138% federal poverty level, and they're not also elderly or disabled or have dependent children or pregnant. They're low-income adults, period. And those are the folks that we serve here.
Wow. Well, by the sounds of it then, you must have a lot on your plate. You must see a lot of people. How many people do you see like in a week or a month's time?
Well, let's see. Probably about over 100 a month. Yeah.
You don't do that all yourself, of course.
No.
So you were telling us earlier too about the volunteers. How many volunteers make the community care clinic operate smoothly?
Over 100 volunteers. 100 seems to be the magic number for us.
100?
But yeah, over 100 volunteers. We have about 20 medical providers that work with us. So we have primary care providers. Harmony Women's Clinic comes over and does a monthly GYN clinic for us. We have folks from Boone Dermatology that come and do dermatology. We have a neurologist, a chiropractor, physical therapist. So all those folks volunteer their time. Then we have about 30, 35 folks that have a medical background of some sort. So an RN or a CNA or an EMT or one of those alphabet soup kind of things. Yeah. And then we have about 30 volunteers that don't have a medical background, but they come and help us do things like answer the phones and schedule patients and do filing for us and
any
things
app
like that.
students that maybe are in
yes,
medical
absolutely.
Degrees?
Yes, yes, absolutely. Yeah. There's I believe it's called the Health Promotions Club at ASU, and we have quite a few students that volunteer with us and end up going to medical school.
Oh yeah,
so,
sure.
Yeah. And then we also have students from the social work department that come and help us, and some from the health management department.
Now we met you here because we've given you a donation for what you do, and we wanted to be involved in that because we believe in your program and what you're doing and what you're providing for the people. But how is the community care clinic funded?
Primarily, we're funded through a grant through the Office of Rural Health in the state of North Carolina. And that is an office that has funding through the state budget, and it's distributed to free clinics through a grant-funded, competitive grant process. So not assured funding, but so far we've been very fortunate for the last 10 years to receive funds from there. But the second, by far, biggest part of our budget comes from the donations that we get from the community and from the wonderful people like Subaru, because that makes up a substantial amount.
So
of
this other funding, this rural thing that you mentioned, would not cover all your expenses?
No. Our budget is right about $500,000 a year, and our grant funding through the state is $150,000. So it's about a third of our budget. So we definitely look to the community for support to keep our doors open.
Yeah. Well, we're thrilled to be a partner with you in a small way, and we hope many other people would join, maybe, to become partners with you and they can help out. Who would they contact if someone wanted to be involved, either by a donation or, let's say, to volunteer? Or if they need help?
Absolutely. They're welcome to contact me here at the clinic, and we also have a volunteer coordinator that they can speak with about volunteering. Sometimes supporting the clinic means something as fun and easy as coming to a fundraising event and just having some fun and knowing that your ticket sale went to help support us. Right. Just contact Melissa at the clinic and I'll be glad to talk with you.
All right, great. All right, well, thank you very much for your time and
thank
for
you
the wonderful
so
work
much.
you do here.
Thank you.